Okay, hi everybody. I'm going to make a brief audio recording of the generic and brand names and how they're pronounced from your formulary. This is one thing that can be kind of frustrating if you're trying to learn a bunch of words here and you're not sure how to pronounce them. So we'll do this pretty quickly. I'll just run through them. I've got my formulary up on the screen here. It's open to page 4, so you can get your paper formulary and follow along, or you can just follow along on the screen. And I'll pronounce the drug names, the generic and then the brand name, and just make a quick comment about the classification. Probably nothing more than what's just in that column there. Okay, so let's go ahead and get started. Some of these are familiar to you, some are very easy to pronounce. I'll move through them pretty quickly. So others are a little bit more challenging and are drugs you haven't been exposed to previously. So activated charcoal, brand name Actidose. It's an adsorbent compound, very messy to administer, not given very frequently anymore in the back of the ambulance. Adenosine or adenocard, which is a drug that slows the heart down, so it's a supraventricular, acts on the top part of the heart, antidysrhythmic. Albuterol, a drug you learned about in EMT training. Proventil and Ventolin are brand names. It's a sympathomimetic bronchodilator, just meaning that it stimulates the sympathetic nervous system and dilates the bronchioles. Amiodarone or cortisone, which is a ventricular and for that matter supraventricular antidysrhythmic drug, figures in pretty big in the ACLS algorithms. Aspirin, we don't give it. We're familiar with aspirin as a drug that lowers a fever or relieves pain. We give it for a little different reason in EMS, and that is to prevent platelets from sticking together. Atropine, which is a drug that speeds the heart up. Calcium chloride, an electrolyte. Dextrose, a carbohydrate. Diazepam, which is Valium, a drug you're probably familiar with it. It's in the class benzodiazepines, which are sedative drugs. Diltiazem or Cardizem, which is an antidysrhythmic that acts by blocking the calcium channels. Diphenhydramine, a drug you're probably familiar with, though you may not be so much with the generic name. We call it Benadryl. It's an over-the-counter antihistamine, which we use for anaphylactic shock and allergic reactions. Dopamine or inotropin, which is a sympathomimetic drug we give in patients who have low blood pressure. Epinephrine, you're familiar with. You learned about the EpiPen. It's a sympathomimetic drug. Fentanyl or sublimase, a narcotic drug used quite often to relieve pain. Furosemide or Lasix, which is a diuretic, stimulates the production of urine. Glucagon, which is an IM injection given to increase the blood glucose level. It stimulates production of glucose from glycogen in the liver. Haloperidol or Haldol, which is an antipsychotic drug. Heparin, an anticoagulant. Hydromorphone or Dilaudid, which is another narcotic, a pretty powerful narcotic, not used too much in the ambulance or pre-hospital, but used a lot in the emergency department. Ipratropium bromide or Atrovent, another bronchodilator. This one works by blocking the cholinergic side of the autonomic nervous system. Ketamine or Ketalar, a new drug in the formulary this year. It is a potent sedative analgesic drug. Labetalol or Normidine or Trandate, which is a alpha beta blocker, so it's a sympathetic antagonist. We'll learn a lot more about all of these sympathomimetic, sympathetic terms in the coming weeks, but anyway, it works on the autonomic nervous system, as do a number of these drugs. Lactated ringers, an IV solution. Lidocaine, another ventricular antidysrhythmic. Lorazepam or Ativan, which is a benzodiazepine. So you've got now Valium and Ativan, a couple of benzodiazepine type drugs, mag sulfate or magnesium sulfate, another electrolyte, methylprednisolone or solumedrol, which is a steroid potent anti-inflammatory medication, again methylprednisolone, metoprolol or Lopressor, which is another sympatholytic or sympathetic blocker similar to labetalol. Midazolam or Versed, which is the third of the benzodiazepine drugs in your formulary. Morphine sulfate, the third of the narcotic drugs. We mentioned fentanyl and Dilaudid already. Naloxone or Narcan, which inhibits or blocks narcotic drugs. So it's a narcotic antagonist. Nitroglycerin goes by trade names of Nitrostat, Nitrobid, or Nitrolingual. These are different forms all the way from pills to sprays to topical cream. Norepinephrine or Levophed, another new drug in your formulary this year. It is a sympathomimetic or a sympathetic stimulator. Ondansetron or Zofran, which is an antiemetic or anti-nausea vomiting drug. Oxygen. Oxytocin or Pitocin, which is a drug we give to help stop postpartum hemorrhage. It stimulates the posterior pituitary to release a hormone that helps to stop postpartum hemorrhage. Sodium chloride, another IV solution. Sodium bicarbonate, another electrolyte solution. In this case, brings about an alkalinizing state in the body. And finally, thiamine, which is a drug sometimes given to patients who have a history of alcoholism. So there you go. I hope that's helpful in learning how to pronounce these medications.